So she's just carrying a lot of extra weight, and she's got what we call here facet syndrome because the belly's dropped down. Very common. 1, 2, 3, good. And blow all the way out. Good. And another deep breath in. Tuck the chin. Quarter of a sit up. There, good. And blow out. Okay, so if you're pregnant, obviously the chiropractor has to have a table that does something like that. She's showing, so you know we need to make sure that there's space for the baby. So the other thing we can do is raise that up and hold on. Okay, go ahead.
That's better.
All right. So you're having some back pain right there on that left side. Okay, and how is it over here on the right side? Also okay. So she's just carrying a lot of extra weight, and she's got what we call here facet syndrome because the belly's dropped down. Very common for people with, you know, big bellies. Not just pregnant women, but guys with big bellies and weak abdominals. It's called lower cross syndrome. That's the technical name for it. And then that's putting a lot of pressure up here on her thoracic spine, which you're really sensitive right there.
Yeah.
Feel that? And then across the upper back, because she's being pulled forward. So we're going to adjust this part of your spine here, but we're going to do it a little differently than we did with Edgar, okay? Looks like your pelvis is even. So for her, pelvis was even on standing and lying down. So the issue is not putting her on her side. The issue is right here, the lumbosacral joint. So.
Also, even when I lay on my back on the floor, like it hurts.
On your back?
On my lower back. Like,
do you bend your knees?
No, like when I'm straight out.
No. So when you do that, okay, so this is a great question and point. So when you lay on your back, when you lay on your stomach, your back does this. It hyperextends at the lumbosacral joint. When you lay on your back, same thing. You have that arch in your back. So if you bend your knees this way and put your feet flat on the floor with your knees bent, that's going to take the pressure off your lower back, okay? So you want to tilt your pelvis. Your pelvis is tilted forward right now. We want to bring it back.
Right.
So I'm going to do that right now for you. I'm going to do some Cox Flexion distraction technique. You okay here? You sure you're not having twins?
Oh my god.
I was hoping.
He wanted to.
Oh, you were hoping for twins, huh?
One and done.
We had a young lady in here years ago who had the scoliosis surgery. You okay here? Take it a little sensitive there?
No.
How about right there?
A little bit.
Okay. Tell me where it's really sensitive.
There.
Okay, take a deep breath in. So her body is producing more of a hormone than most of us called elastin. And that helps to stretch the ligaments and tendons out. So her back is unstable just because she's pregnant, just that alone. Plus all the extra weight, you know, in the front of her. So it's a balancing act. And too bad she didn't come in. How long have you had back pain? The whole pregnancy or?
Starting 6 months.
Okay, well, better late than never, right, folks? Now with a breech pregnancy, oftentimes I have to adjust the pelvis. The pelvis is really out of alignment, and that's part of why the baby is breech. How we doing here?
I feel a stretch and nothing out.
Painful stretch?
Not that much, it was mild, but usually it's at the
Okay.
end of the day. Oh.
Do you feel it more on the left or on the right usually?
On the left, yeah, on the left one.
So that machine that I have, you know, probably not the best to use on her. She's due in 5 weeks, you know, so we would want to use hand therapy, myofascial work. This is months and months of muscle guarding, and I could feel it. So when you sleep at night, you can either sleep, you know, in the fetal position, right, knees up to the chest, you know which side, right?
On the left?
Mm-hmm. And then you also could sleep on your back, you know, but knees bent, not straight, not legs straight out. So best way to do that is put a handful of pillows underneath you. 1 or 2 is not going to do it. It's not going to bend them up enough. So in a way, you're flattening this part of your spine
Yeah.
down to the floor. There's a lot of chiropractic techniques that could be used for pregnant women, okay? This is just one of them. How are we doing? It's a lot easier now, isn't it?
Yeah.
Okay, this is also her first adjustment. Alright, so now I'm going to have you turn over on your back, and I'm going to pull this out here.
There?
Mm-hmm. Okay. Cross your arms in front of you. Give yourself a big hug here, okay? Tuck your chin down. Take a deep breath in. Come on up, half a sit-up. Just not even a half a sit-up. Ready? 1, 2, 3. Good. And blow all the way out. Good. And another deep breath in. Tuck the chin. Quarter of a sit-up. There. Good. And blow out. Okay. Not so bad, right?
Oh, so good.
Okay, you can relax your arms. And if you could pull your mask up over your nose, please. Thanks. All right. Yeah, you know, a chiropractic adjustment is much safer than taking any pill, that's for sure. So, yeah, unfortunately you didn't come in 6 months ago when you were having some pain, but also things were a little crazy here with the pandemic. Do you have a headache now, today?
No.
Okay, just some neck stiffness on this left side?
On the left side, yeah. I've had that for a long time.
Okay. So you have a few subluxations here in the neck. Relax here. If you're wondering what a subluxation is, you can zoom in there. Subluxation is one vertebra being out of alignment next to the other one. And you'll see the vertebra here where it's shifted. A lot of things can cause subluxations, but the resulting irritation of the soft tissues and the nerves at that level create other problems that can radiate into other areas. So that, now I know that's weird, I adjusted you on the right side, right? But feel the difference on the left already? So, and deep breath in and blow all the way out. Do you carry something heavy on that left side usually, or no? Make him carry it? Just kidding. Good man. All right. Now, I'm going to have you roll over to your side and get up that way. Okay, so there we go. Push off your elbow and your hand. Swing your legs down at the same time. Yep, that's the way to get up. Okay, not coming up like that. Okay, I'll see you guys in 2-3 days. Okay, Sam will help you up front. And thanks for showing everybody on YouTube, you know, your first adjustment.
Thank you.
Very
Yeah.
informational.
Thanks for tubing in.